Okay, so now we need to look at McKenzie extension exercises. Um, this is kind of a cool story. McKenzie was a physical therapist, and he had a patient who came in one day, and the patient was like, "Oh, you've got to help me. I can't even straighten up. My back is killing me." And McKenzie went, "Oh, okay, well, go to room 3, lay down on your stomach, and I'll be there in a minute." Well, what he didn't know that in room 3, the table had been left up in a semi-Fowler's position. So the patient laid down on their stomach, but they were arched really far back. And McKenzie was about 10 minutes, and he went in the room, and the patient's like, "The pain is gone from my leg. I feel so much better. That was amazing." And of course, McKenzie went, "Well, of course, yeah, I'm so glad that worked." And then he went, "Oh, what just happened?" So he kind of did something by accident, it worked, and then he had to work out the physiology and the anatomy and figure out, hey, this guy had a disc protrusion, which he later found out. And what this did, hey, being in this extended position, what is that going to do to the disc material? It's going to push it back forward. It's going to reduce the disc. It's going to get the extruded disc material back where it belonged, taking pressure off the nerve and getting rid of pain. So through lots of study and lots of experiments and lots of trying this out on lots of different patients, he came up with the whole McKenzie system, the whole program. So where McKenzie starts is with laying down prone, okay? Because you can see when you lay down prone, you end up with a slight lumbar lordosis, okay? I told you I'd tell you about the worst patient I ever had. Worse, and this is symptom-wise. He came in and he was bent over. He could not straighten up. He had tears rolling down his face. He was in so much pain. And what does my script say? Evaluate and treat. I went, great. So I said, have you had any testing done? Do you know what's going on? And he said, the doctor thinks it's my disc. And I said, okay, well, that could make sense. He couldn't even lay on the table like this. What I had to do, these are going to go up under your hips. Okay. I started him off with about 6 pillows. Go ahead and lay down. Okay. So he was still flexed forward. Okay. But now he didn't have weight. Okay. And this is 6 pillows. It was like up like this. So every 10 minutes or so, I'd come and see how he was doing. It would take him a while to adjust to the new position. And he's like, okay, I'm doing okay. And I say, okay, I'm going to take a pillow out. Okay, can you just lift up a tiny bit? And I would get it. He didn't do that, of course. But in the course of an hour, I got him laying flat on a table. And that's all I could do day 1. I couldn't even really do an eval, except take history and get his symptoms. Okay, because he couldn't move. I couldn't really test anything. Okay, so I'm going to take this one out too. So when you can get here, this is stage 1. Okay, just this little bit of lumbar lordosis. And I'll have the patient breathe. Take a nice deep breath for me in and out, and watch what happens to her back. When she exhales, she sinks. She gets more lumbar lordosis. So it's a little bit like a mobilization that she's doing to herself with her breath. Okay? So I would have asked her, what's your pain? Any radiculopathy? What's happening? So let's say, patient, that your pain is a 5 out of 10, okay, and it's in your back, it's in your butt, and it's shooting down to your knee.
Okay.
Okay? So that's where it is. When you came in, I have you lay here for a minute, okay? Maybe even 10 minutes. And I say, okay, how is it now? And you say, pain in my back's like a 4, still down to my knee, but it's not as bad. Okay, great. Okay, has it changed at all in the last few minutes? And she's like, no, it's, once I laid down, it the pain got a little better, but it stayed kind of the same for the past little bit. I go, okay, that means you're ready to progress. Okay, we got all the benefit we could out of this position, and it's time to move forward. So the next picture in your book is a pillow under the chest. So raise that for me, and we're just going to lay this right up underneath your chest. Okay, and you can see we get a little bit more lumbar lordosis. Okay, and again, I just want her to breathe. I want her to relax into this. Okay, again, I may leave her there 3 minutes, 5 minutes, 10 minutes. Okay, I'm gonna keep coming back and check on her. Okay, and I'm gonna say, okay, what's it like now? Well, she really likes this. Okay, she says, pain in the back's a 4, but you know what? It's not down to my knee anymore. It's like mid-thigh now. Awesome. Okay, great. Do you still feel like it's lessening? Yeah, I think it's getting a little bit less. Okay, let's stay there then. I'm gonna walk away. I'm gonna let her stay there.
Yeah.
I'm gonna give her this as homework.
Yay.
Okay?
Best homework.
Best homework ever. Lay down. Lay down and breathe. Just relax.
Yay.
Okay? When we've gotten all the benefit we can out of this, we're going to go to the next progression, which is we're going to take this away, and I want you to go up on your elbows. Good. Okay? And just let your tummy sink down to the table, not your shoulder. No, keep your head up, because if your head is up, your butt is down. Okay? And just take some nice deep breaths. Good. Now, sometimes people don't have the segmental mobility to hold this position. They're tight. Okay? And they, oh, there's so much pressure. I don't like it. Okay? So what you could do, a modification is milking. So what I want you to do is I want you to slide out and up and out and up with your elbows. Yep, 10 times. Up. Good, keep going. A couple more. Okay, and I can have her do that like 10 times. I know. Okay, because what that is, she doesn't have to hold the position. She doesn't get the pressure, but she gets the movement. Okay, something else you'll see, I'm gonna climb up on the table with you, okay?
Okay.
I want you to get your elbows right here.
Right
up under your shoulders, right there, good. Okay, what you might see the therapist do is spinal mobilizations. Okay, don't. I'm gonna wait for my patient to stop laughing. Okay, take a deep breath in and blow out, and on the exhale, I might give a little overpressure here at the base of her spine, okay? I have another video that I'm gonna post. I'm gonna post 2, and in that one, Dr. K is the therapist and I'm playing the patient, and we'll talk through and you can see kind of the full lumbar extension, okay? Again, I want to know what this is doing. Another modification I can make is I want you to breathe out and breathe in and breathe out, and watch when she exhales, you'll see that sink. Okay, I could even have her add this to the milking. Okay, so I want you to go out, and as you come up, okay, so take a deep breath in right now, and as you come up, exhale, and hold it, and then breathe in as you go down, and out as you come up. Very nice. Okay, so you can put those 2 things together. Okay, the last part of the progression here is prone on straight arms. So, nope, you're gonna have your hands right underneath your shoulders like a push-up. And I want you to try to get your elbows straight. Push all the way up, bring your chest away from the table. Lift up, 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 up. There you go. And you can see her hip bones are not on the table, so she can't quite do this position. So walk your hands out a little bit more until you feel your hip bone on the table, right there. Okay, so this is where she can go. So she is about T11, T12 flexion. She's not flexing into her lumbar spine. So she would need a little bit of mobilization and a little bit of practice right here. So again, is this a lot of pressure?
Yeah.
Okay, so do some of the deep breaths for me. And you feel how much more pressure you get when you breathe out? Okay, another thing you could do is go ahead and put your hands here like in a push-up position.
Like that?
But go ahead and lay down flat, and now push up. We're gonna go back to the milking and down, okay? So as you take a deep breath in, and as you come up, breathe out, and come down. So you can see, I mean, she's young and there's nothing wrong with her back, and she does not have full extension through the lumbar spine, okay? So we have to do this for a while, and we have to work up to that, getting all that segmental mobility. So remember, the two discs that are most often involved are L4, L5, and L5S1, which are way down here. And she's not getting any extension down that low. So we have to build up and get that mobility so we can actually mobilize all the way down at the discs that we need to. Okay? Once she can do it in this position, like I showed you on the PowerPoint, sometimes you give them standing extension to do at home. Another one I really like, I'm gonna come over here. You can sit up, sweetie. I don't wanna be in your space. Another one I really like, because they can do it at work real easy, is put your hands on a desk and sink your hips in and bring your head back. And again, you get that extension. That one's real easy to do in the kitchen or in the bathroom or at your desk, okay? And again, the idea is that they should be doing that, every day, usually twice a day, but also whenever they feel the radicular symptoms coming back. While this disc is active and these nerves are irritated, anytime those nerves get pressure on them, they're gonna send a zing or tingling or burning down the distribution of the nerve. But if whenever they feel that, they can stop immediately and extend and push that disc material back, that nerve won't be as irritated and it will heal up faster, okay? So one of the biggest things you can do is education, so that they know what to do to handle their symptoms and make their symptoms go away, okay? Some other things these patients with a herniated disc are gonna feel is they're gonna have trouble with sitting for long periods of time. So you want to do some body mechanic, body training. So teaching them to use a lumbar roll, which is a large hand towel or a small bath towel. And you can roll it up and you have them put it right in the small of their back in their chair so that it's helping to maintain this lumbar curve. I tell them to have one in their car, have one at their desk at work, have one at their seat at the kitchen table, and they can tape it so it stays in good shape. You can also buy lumbar rolls that are nice and made out of foam, and they attach to the chair so it doesn't slide, and those are good. And you're going to teach them, of course, about body mechanics and not slumping, because again, that flexed posture is going to really extrude that disc material. So lots of education while we're trying to calm down their symptoms with these lumbar extension exercises. McKenzie extension for a herniated disc. Okay, thank you.